Lauren is in the newsroom with Dr. Ahluwalia. Lauren, so what is it with this hair loss drug? Is Propecia, right?
Yeah, a lot of men take Propecia, but now they're finding out that something that's in Propecia actually has risk of cancer. Is that correct?
Yeah, Lauren. So there are these medicines like Proscar and other medicines of the similar sort where they treat men who have benign prostatic hypertrophy. Basically, it means that the prostate becomes big as you get older. And so it's difficulty urinating, all these kind of things. So we give them medicines to shrink the size so that they can urinate better.
Right.
But we thought that it reduces the risk of prostate cancer. So we did these studies. We did 2 huge studies to prove that it reduces the risk of cancer. And what we found is it does reduce the risk of low-grade malignancy, but it actually increases the risk of high-grade malignancy.
There's a but, yeah.
Right.
So it, wow.
So that's something that we need to be a little concerned about.
However, in Propecia, this is something I read in the study, there is such a small amount,
Yes.
but the FDA still wants that label on the drugs that it increases your risk of prostate cancer, which is huge because I don't know if a lot of men would take it if they see that. Do you?
Propecia has 1/5 the dose of Proscar, right?
Right.
But the thing is, they said if Proscar causes the cancer, we should let people know that this may. We have no studies on Propecia, but it's just to let people know. So if you're on Proscar, if you're on Propecia, please talk to your doctor, get your PSAs, make sure that you're on top of this.
Oh, that's scary.
Yeah, so I mean, it's good to be educated, it's good to know, and
And we're talking all things men here today, and this is something new. So there could be a male contraceptive soon. They're doing tests right now, and it seems like it's working.
Yes, well, it's every woman's dream, right?
Or every man's dream. There's like men out there that are cheering. Are you kidding?
Yeah, exactly. So we've been trying to work at this for a while, and the current options are vasectomy, which is invasive, or condoms, which is no fun.
Exactly. Or trust the woman, which also could be no fun.
Exactly. So we've been trying to find medicines that work in men. And a lot of these medicines have other reasons why they've been used, and they just had a side effect of either decreasing the sperm count or not make the sperms work so well. And so we're trying to do tests on men to see if it works.
And this one worked. It decreased the sperm count in the man, made it almost 0.
Right.
And this one man who was taking it didn't get his wife pregnant, and then stopped taking it, and then was actually able to get his wife pregnant. So, the studies are going well.
Yes, so human trials are in place, and we're trying this stuff out, but, they all have some side effects.
This was a side effect, you guys. I thought it was very fascinating. So you take this pill that lowers your sperm count.
Yes.
It also makes it so you can't drink, because when you drink, you vomit. And
yes.
So without alcohol, you don't really even need the pill.
So you have a choice to make, right?
Now, do you think they're going to perfect that eventually?
Yes, I think that the process works to see what works well, what doesn't work well. Just like women have, the hormone thing that you can implant,
or the
patch that you can use. So we're trying to use similar things in men to see if the hormonal changes can decrease the sperm count.
So a male contraceptive is in the near future. Is that what you're saying?
Yes, it's in the works for women or for men. Whoever wants it.
Great.
Yes.
Okay. One last thing. We just talked about the patents expiring on all of the drugs, so that there's a lot of generics out there. So drugs are going to be cheaper. That's a good thing, isn't it?
It's an excellent thing. I think we do need to give kudos to all the pharmaceutical companies who spend a lot of money doing research, and that's how we get all these new drugs. But I think what happens is that, we've set up these laws to make sure that they get the benefit, and then it goes into the generic category. But a lot of the companies will then file another patent, just changing it slightly, right? Making it longer lasting.
So that they get right.
Exactly.
Okay.
So
all right, so a lot of good things happening, Dr. Ahluwalia. And you guys, the male contraceptive is right around the corner.
Please, I've been hearing that. I've been doing this show for 17 years. I've been in news for 23. Every 3 years it comes out, the male contraceptive. I have yet to see it happen. I don't believe it.
Well, the tests are good, though.
Why do you think that is?
Well,
think maybe it's because men are doing the research?
That, and I don't think any man is going to sit and take a pill on a daily basis.
Trust me, they'll take a pill. I think men will actually be more responsible sometimes because they're like, this is not happening.
But here's the question: will the women trust the men who are on the male contraceptive?
No.
So men and women don't trust each other, and then there's babies everywhere.
Okay, ask Dr. Ahluwalia, what is safer, taking this new contraceptive or a vasectomy?
Vasectomy.
Yeah.
There you go.
Yeah, because they don't have all the studies, I'm sure, yet on the
Yeah,
pill.
but it's like knives and needles.
Yeah, knives and needles around that whole area.
Vasectomy. Rick Dicker got one up in Sky Fox. It was in out the same day. It's not a big deal.
And I gave it to him.
Sky Fox.
It was cheap.
He got it in Sky Fox.
Okay, stay with me, people. It was an in-out thing. Same day. He was surfing the next day. It's not
with a bag of ice on him.
No. It works really well. So for everybody out there, vasectomy is excellent.
Yeah. And they're reversible. Let's mention that, Doc.
That one's painful, though.
You don't go in.
They're reversible.
The unsnipping is painful.
All right, moving on.
Well, if you want kids, it's worth it.